I'm gonna do my blood transfusion pass-off. So first, I'm going to grab my orders and check and look at my patient, and his blood has been cross-matched. His blood has been cross-matched, and it is compatible. It has been signed, so you're good. All right, let's go into the room. Hello, I'm gonna be your nurse today. I'm just going to grab some vital signs, and I'm going to check your lungs and give you any pre-meds for this transfusion. We have to do that 30 minutes before, so we're gonna hurry and get all those. So I got his vitals. I'm going to listen to his lungs. All right, I'm just gonna have you take a few deep breaths for me. We're doing this blood transfusion because you have a GI bleed. All right, and I'll have you set up now. Okay, and then I'll do 6 places on the back as well. All right, now that your vitals are done, I'm going to check for any swelling or edema because your lungs sounded good. I'm just gonna hurry and check your legs really fast. There's no swelling or edema in any of his legs. Okay, now that I've got his vitals, I'm going to check the patency of his IV with the flush. So I'll grab an alcohol prep and a flush real fast. Scrub 30 seconds. Okay, 30 seconds. All right, and it flushes well. So now I'm gonna take that off and lock it. Okay, so some of the signs and symptoms that you might feel that are adverse reactions that we don't like are itchiness, fever, swelling of any sort, hives, if you feel short of breath, if you're feeling flushed. Those are all things that we need to know about so that we can check to make sure you're not having an adverse reaction. So now I'm going to get my fluid and my wine primed. This is NS, and all it is doing is priming my line. Grab a garbage can. Sweet. Okay, now I'm just going to open just this one, close this one, making sure to keep that end sterile.
I'll hold this and you can.
Thank you. It's not. Maybe.
So I can trade you.
Maybe. This one might not actually come out.
Okay.
Yeah. Here, I'll have you try.
I don't know if it's gonna come out. I got it to move part way, but it's not letting go at that one section.
Oh, sweet. Thank you.
Sorry.
Thank you. Okay, and I'll just put that in there. And then I'm going to make sure that this has enough in it that sits above the filter. So that's locked. This one's locked. So we want to fill this filter up. Okay, that should be enough. Now I'm gonna prime the rest of my tubing, making sure that stays above. Open my tubing. Okay, good. And depending on how my patient is, I would either hook this up and let it run or just cap it. So I'll just cap it for right now, depending on the orders. All right, now I'm gonna go to the blood bank and I'll grab my second nurse and we're going to do our double check with another nurse.
Okay, sorry, let me pull my paperwork.
Okay, sweet. So,
Okay, so we'll start out with the patient's name.
oh
correct?
yes, I'll read that. If you want to look at his band for me, make sure we got my two patients. Okay,
I'll look
so-
at this and read it to
okay.
you and you read it back, okay?
sure.
Okay, we have Darius Hasten,
Darius Hasten,
a birth date of 8/10 of 2025.
8/10 of 2025.
We have a medical record number of 982541367.
982541367.
Okay, and then on your blood, you can go through and do the type in that.
He has no known allergies, correct? No known allergies. Yep.
Okay.
Okay, no known allergies. Okay, now his blood is A positive.
Correct, A positive,
His antibody screening is negative.
negative,
His cross-match compatibility was compatible.
compatible.
Okay, now do you want to read this name with me? Okay, so I have A positive,
A positive,
donor is O negative. O negative.
O negative on here. Okay,
Yep.
O negative. Yep.
Yes, so that's just
Oh, the
compatible.
blood is
Yep.
compatible, yes.
Okay, and now I need you to read me that number.
Okay, we're gonna do WZ or WO430
WO430
17 029897.
029897. Okay, and now I'm just going to check the back to make sure that there's no air, frothy, or clumps in here. Okay, and now that my line is here, I'm going to start my line, making sure that I start this line 30 minutes of getting it from the blood bank. Okay, and I've done a double check and he has his consent form signed. Sweet. I have provided privacy throughout this whole thing. Oh no. This one might not come out either. Here, I'll let you try. I'll perform hand hygiene.
That one's really stuck. I don't know if we're gonna get that one
We
out.
have our baseline vitals. We have performed hand hygiene. We've given meds. We've made sure the line is good. All this 30 minutes prior.
It's starting to slip, but I don't want to like push.
Push and
I
get
don't
it
want to go
everywhere.
everywhere. Okay, I'll let you try.
Sweet.
Is it letting go?
Nope.
Oh, gosh. Good job. I didn't get it
You didn't
anywhere,
get
right?
it.
Okay. All right.
That would go in the garbage. Okay. Now we're gonna turn this one off so that it doesn't go back up into the bag. We'll turn this one off, and it's off. Okay. That one's off for right now, just till I prime it. Now that it's hung, super slowly, I'm gonna make sure that it drops into the water. Okay. Slowly let it come in to it. Okay, we're good now. That's off. We'll just let this turn that off. Okay, now I got to scrub the hub of this for 30 seconds vigorously. Forward. Okay, 30 seconds. I'll make sure to infuse this very slowly. 2 milliliters for 15 minutes. For 15 minutes. All of my lines are open except for this one now. Okay. And I'll make sure to slow it down once it hits the line. Okay. The time that it hit the arm was 10:51. I'll slow it down to 2 milliliters every 15 minutes. And I'll do that for 15 minutes. And I'll come back and get a set of vitals. Since I already have my baseline, I'll do another set of vitals to make sure that we don't have any complications happening. If there was to have complications happening, we would immediately stop the infusion. We would disclude all of it, flush the line, take it to the, you have to contact the provider, and then you'll take it to the blood bank and have them make sure everything's good. All right, 15 minutes, vitals were taken, everything looks good. We'll speed up the transfusion to make sure that it's done within the 4 hours of getting it from start to finish. It's within 4 hours. And we'll wait. And then after, we'll get vitals an hour after and 2 hours after. So we'll let this transfuse. Okay, now that it's done, we'll turn that off, turn the blood off, and we'll go NS all the way through till the line is clear. And maybe it's because this one's blocked off. Open it up all the way and clear the line out. But for the sake of this video, the line is clear. And I'll stop everything. And I will grab a bag. Now I will put all of this in the bag, including this. I will and I will scrub with an alcohol prep pad and flush the line. Okay, 30 minutes and flush my line again. Okay. Now that my patient is done with his transfusion, I'll come back in 1 hour and do another set of vitals, and then I'll come back again in 2 hours and do another set of vitals, still making sure that there's no reaction to the blood transfusion. And I will go document all my findings.